Hi, good morning or good evening whenever you watch this. My name is Dr. Raphael Allred, and I am very privileged to be here with you. And I'm going to pretend you're sitting in this room with me. My darling daughter is actually my cameraman, but I'm going to pretend all of us are in the same room. And so this is like super casual. It's not going to be perfect. I'm not going to re-record this a million times to get it right. So if I make a mistake, give me some grace. I just want to spend 2 minutes telling you about me and why I'm doing this, and then we'll get to anxiety and depression. So I am a family physician. I've been in practice for about 20 years. I am not a clinical psychiatrist. I'm not a research psychiatrist. So some of what I explain is completely simplified. And if you know a ton about neurotransmitters, you might say, that's not exactly how that works. And so again, I'm doing this just to be very simple, and I'm relating it to you as I relate it to my patients and to myself. I live in Bend, Oregon. I am a wife and I'm a mother of 3 fabulous kids. I'm a disciple of Jesus Christ, and I'm a small business owner. I own my own clinic. My practice is West Bend Family Medicine, and we've been here about 14 years now. I have been praying to know what to say. So if you feel like this video is for you, then it probably is for you. And so I hope that something I say today can be helpful. All right, so I wanted to run this in a way that wasn't super boring. So I asked one of my dear friends who suffers from anxiety and depression what questions she would like answered if she were sitting in the room. And so I'm gonna run this as a Q&A. And hopefully by the time we're done, I've answered the questions that you might have about depression and anxiety, because one of the things that we wanted to accomplish with this workshop was to talk about specifically Christian believers and why it's so difficult for us to suffer from anxiety and depression, and kind of the stigma around that. And so I'm super grateful that the Women's Retreat Director asked me to do this. So the first question is, what is clinical depression? How is it different from situational depression versus PTSD and depression that way versus like postpartum depression? So first of all, clinical depression is just a fancy term we use for a depression that just is ongoing and unrelenting, and causes chemical changes in your brain, or is caused by chemical changes in your brain. So basically I think of it as a chemical imbalance. Just like a diabetic doesn't have enough insulin, when you have depression or severe anxiety, your neurotransmitters like serotonin and GABA levels are very low. And this is my super professional diagram of how I think about it. So pretend you have a sink in your brain, and I'll explain all the writing later. But you have a sink in your brain and you have serotonin levels, and they're supposed to be up here, and your brain drips in serotonin, and then there's a garbage disposal at the bottom that grinds it up for parts and recycles. And so again, optimally your serotonin levels are up here, but if you have chronic pain and illness, stress, family, genetics predispose you to low serotonin levels, then you're grinding it up as fast as you can drip it in, and suddenly you have no chemical or emotional reserves. That's when you feel like even opening your mail to pay your bills is overwhelming, or your kid spills milk on the floor and you like lose it. You're like, what is going on with me? It's because your serotonin levels are low. Situational depression is basically when you're depressed because you're stuck in a situation. And the way you know that is, say you hate your job, you feel much better on the weekends. You go on vacation, you feel much better. Or you're in an abusive relationship and you go away and you feel much better. Trauma or PTSD, you're stuck in a thinking loop where you relive the trauma over and over again, and it affects how you're thinking and how you're behaving. Either situational depression or trauma, PTSD, if you don't get them treated and they go on long enough, they can turn into clinical depression. Postpartum depression is extremely hormonal. Your estrogen levels are crashing, your progesterone levels are crashing. You end up with very dark thoughts like, I want to throw my baby over the railing, and then of course you're horrified. So that is something very different, and I would say absolutely get that treated right away. Don't wait. Don't try anything I'm going to talk about as far as treating depression. And the other thing to notice is, to know about depression is chronic untreated anxiety also leads to depression. So it's important to treat your anxiety. And addiction, if you have an addiction, especially a chemical addiction, it leads to chemical changes in your brain, sleep disturbances, all of which can lead to depression, usually addicts or self-treating anxiety. So again, if you have that issue, please get help. The second question is, how and why is depression different in women than men? And again, this is something that we get to talk about, hormones. So if you look at this, I always think of it as a triangle, and each of these corners affects the other corners and can pull it off balance. So down here we have female hormones, estrogen, progesterone, prolactin. Then we have your thyroid hormones, and then up here we have your neurotransmitters like GABA and serotonin. So if your thyroid gets low, you gain weight, you don't feel good, and you often feel depressed, and it affects your hormones, and your periods get wacky. Same thing with your female hormones. If you're going through menopause or you're starting your period, it can affect the other two. Most directly, this affects that. So if you have depression and you're a woman, you often have, if you have, again, female hormone issues and serotonin, they're all kind of tied together. So women tend to get weepy or very anxious. Men sometimes do that, but sometimes they just get really irritable and aggressive and angry because, of course, their testosterone plays into it too. The other question is, how does stress play into depression? So again, I have a very professional diagram that I wrote out. So stress is, well, stress and sleep. Let's talk about stress and sleep. So there's this vicious cycle. So if you have poor sleep, and oftentimes chronic stress can cause poor sleep because you get high cortisol levels. Cortisol is that nasty hormone that, if short-term it's really helpful, but long-term it makes you gain weight around the middle, you become insulin resistant, so your sugars go up and it predisposes you to diabetes, and it can cause a lot of inflammation and pain. But the biggest thing is cortisol is supposed to be high in the morning, low at night. If it's high all the time, you don't sleep. So poor sleep. If you don't sleep, your body's like, oh, I need more cortisol to keep me going, then it causes more sleep. Also, poor sleep, it causes low serotonin. You need sleep to improve your serotonin levels. And if you don't get enough sleep, you get low serotonin levels, which makes you depressed. And then you get this 4 a.m. awakening, anywhere between 2 and 4, and you get poor sleep. And it's this vicious cycle. So big key thing to talk about with sleep. If it starts off with sleep issues, make sure you get checked out for sleep apnea, make sure your chronic pain's treated, make sure your stress levels go down. And I wrote on here, stress levels you can treat with exercise, and there's a supplement called theanine serene with Relora. When you have overwhelm and you don't feel depressed or anxious, you just feel overwhelmed, that is your supplement because it lowers your cortisol levels. Again, that's theanine serene with Relora, and you can buy that off Amazon. All right, so say you have depression and you're like, I feel depressed all the time and I just can't pull it together, but I don't want to take medications. Are there treatment options other than medications? Yes. Make sure you have a support system. Make sure you're talking to people. Make sure you have a spiritual practice, including your scriptures and prayer. Meditation's great. Counseling is, it's like a dental hygienist. I think everybody should have a counselor. Just keeps problems away. Clean your teeth, you don't get cavities, you go to see a counselor, you don't have brain issues. Exercise is my favorite, my personal drug of choice is exercise. It increases endorphins and serotonin, so move your body at least 3 days a week. And then there are some supplements. So counseling, we'll talk about more later, and then supplements, back to my handy diagram. So if you want to increase your faucet, instead of taking medication, because medication acts like a stopper on your garbage disposal to keep you from grinding up your serotonin, but if you don't want to take medication, you can increase the rate that your brain produces serotonin. So there's 5-HTP, take 100 milligrams at night. There's vitamin D3, 4,000 units a day, and vitamin B100 complex. All three of those together are really going to change your brain chemistry, but it takes a lot longer than medication, which is fine. But if you're really in dire straits, I wouldn't start with just supplements. The next question, which is, why is there so much shame and stigma among Christian believers or faith communities regarding depression and anxiety? This is an interesting question because it's very true. We perceive it as a lack of faith if we feel depressed or anxious. Why can't we just pray and lean on Jesus and get through it? So I like to think about it this way. In the Old Testament and even the New Testament, when people had leprosy, they were considered unclean and that they had sinned. And it was very much a cultural view of that. Nowadays, if you have leprosy, you take Zithromax and it goes away. So we know that that is just a bacteria. In John chapter 2, verses 2 and 3, the disciples asked Jesus about a blind man. They're like, who sinned, him or his parents? And Jesus says, neither, of course. It's so that the works of God may be shown forth and that God can be glorified. So again, our view of blindness is different because we understand that it's just something you're born with. So again, right now, culturally, we view depression, anxiety somewhat as a weakness. Instead of understanding it's just like diabetes or hypertension, that is something that people have. So I think a lot of what needs to happen is just education, like what we're doing here today, that you get chemical changes in your brain. Just like depression, just like diabetes and hypertension, you do have some control over it. However, you're not just a victim of this. You can make changes in your life to improve it, and it will get better. So next question, medication. When to start it, how long do you take it, and which one do you take? So there is the question about when to start it. I have these two questionnaires I use all the time in my practice. One of them is called a PHQ-9, a patient health questionnaire. There's 9 questions. It rates depression. And if you're over 10, then I'm like, oh, it's moderate depression. And if you're over 15, then it's severe depression. If you're over 15, I talk to people seriously about medication versus supplements. There's also one, a GAD-7, a general anxiety score of 7 questions. So those you can actually look up and self-score. It's super helpful. So that's kind of gives me a clue about when to start. But basically, if it's affecting your life, your ability to function, take care of your kids, your job, your wife, your husband, that's when we talk about medication. How long to stay on it? You know when you reboot your phone, you have to turn it off and wait 20 seconds? Well, your brain reboot is 9 to 12 months. So when you go on medication, it's not like you're getting a tattoo on your face and you have to keep it forever. But you do need to plan on being on it for 9 to 12 months. And then which one to choose? Great question. And we used to just be like guessing. And normally we start with serotonin reuptake inhibitors, like that garbage disposal stopper. There is something called GeneSight testing. It's a brand name, GeneSight. I do it here in my clinic. You swab your cheek, you send it off to a lab. Most insurances cover it. It tells you which medications your liver and your genetics work best with. So it's a very fabulous tool that I love. But if not, you can start with something traditional. If you have anxiety, then go more towards Zoloft and Lexapro. If you're really low energy, then you can add a norepinephrine inhibitor like Wellbutrin or Effexor. But talk to your physician about it. Question 4, what are panic attacks and are they dangerous? Because when you have a panic attack, it feels like you're dying. My first panic attack, I woke up from a dead sleep in the middle of the night and I couldn't breathe. And I just knew, it was 2 weeks after my daughter was born. And I just knew I had a blood clot in my lung. And I told my husband, I think I have a pulmonary embolism. You need to take me to the emergency room. And he said, I think you're having a panic attack. I think you should take some deep breaths. And they feel awful. And what happens is that something in your brain, so your limbic system is your like lizard brain, I call it. It's your hindbrain. It's your oldest part of your brain. And its job is to perceive threat. And so when you have this perceived threat from your subconscious, then you have an adrenaline flood. And then your body's like, oh, fight or flight. There must be a bear in the room. I want to run away. But instead you're like logically like, no, there's no bear in the room. And so what happens then you get this physical response, a pounding heart, racing, sweaty palms, and it makes it worse because then your brain's like, I really think there's a threat. So it's this vicious cycle. Go outside, move your body. If you get some of that adrenaline out, it really helps. But you can't die from a panic attack. Although you're gonna feel like it, your chest is gonna be heavy, you're gonna feel short of breath, you're gonna be sure you're dying, I promise you're not. But again, if you're having panic attacks, anxiety is awful. It's not logical. You think, well, I know it's nothing, but it's just this constant feeling inside of you that like something's about horrible is about to happen. And that's the difference between anxiety and depression. Anxiety spills outward. Depression, you internalize. Okay, next question. How do you release shame and self-criticism? And that was something I really wanted to talk about in my seminar. Shame and self-criticism are thinking errors. They are not what you need to be doing. Shame is Satan's tool, because shame makes us think we should hide from Jesus and hide what we're doing and hide what we're thinking. And that is the last thing he wants. And so if you're feeling shame, I want you to really recognize that is from Satan and that is not from Jesus. And so again, get into the word, talk to your pastor, talk to your support group. And then self-criticism, oh, we tend to do it all the time, but it's breaking the second commandment. We're supposed to love our neighbor as ourselves. That means we have to love ourselves and give ourselves grace. Give yourself as much grace as the next person. So again, how do you get over these thinking errors? Therapy is fabulous. There's dialectic therapy where you talk to someone and they help you think, like process. There's cognitive behavioral therapy where they help you change what you're thinking. And then affirmations and meditation. So meditation, really, imagine you're with Jesus. Imagine you're at his feet. Imagine you're in the forest. Imagine, go to your favorite place and sit there for a moment. Affirmations, I love that this seminar is all about I am statements because they are so powerful. I want you to notice when you say I am versus I feel. So I tend to say, we all do this, I am tired, I am depressed, I am in pain. I am is so powerful. You want to flip-flop those. I feel tired, I feel depressed, I feel in pain, I feel overwhelmed. Don't use I am in those statements because those are statements your brain then creates as reality, and it's hard to change. So instead, I feel those things, and your I am statement should be things like I am a daughter of God, I am beloved, I am trusted, I am blessed. So really get those written down. Write down what you are, I am, and make them powerful statements. Okay, last thing I want to cover. The last question my friend sent, which I thought was a great one, is how do we navigate things when we're doing everything that's recommended? Exercise, sleep, medication, counseling, spiritual practice, reading the word, and you just still feel depressed. You still feel that heaviness. So from a medical standpoint, my recommendation is make sure you don't have something called an MTHFR gene mutation. You're like, what? It's called methyltetrahydrofolate reductase deficiency. That's why we abbreviate it to MTHFR. And it's a gene mutation where you can't take a certain B vitamin called folate and methylate it, which is the form of it that your brain uses to make serotonin. So no matter how many medications you're on, they never really work because you don't have that main ingredient. It's like baking cookies with no salt. So get tested for an MTHFR gene mutation. Your doctor can do it. That gene site test I was talking to you about, that your doctor can order. If they're not signed up, then we can talk about that in a minute. But if you get tested and you don't have that and you still feel that heaviness and oppression all the time, this is when you surrender it to Jesus and just realize that this is your thorn in your side, as Paul says. And I just want to read 3 scriptures to you. Sweetie, can you hand me my phone? So if we go to 1 Peter, and this is the last 5 minutes of this seminar. If we go to 1 Peter chapter 4, verses 12 and 13, it says, Beloved, think not it strange. Think it not strange concerning the fiery trial which is to try you, as though some strange thing happened unto you. But rejoice inasmuch as ye are partakers of Christ's sufferings, that when his glory shall be revealed, ye may be glad also with exceeding joy. So again, we all have trials, but it brings us closer to him and his glory. Isaiah chapter 61, one of my favorites. I love Isaiah. I could read this whole chapter, but we're going to go to verses 2 and 3. The end of verse 2, it says, so basically Isaiah is saying, I've been appointed to comfort all that mourn, to appoint unto them that mourn in Zion, to give unto them beauty for ashes, the oil of joy for mourning, the garment of praise for the spirit of heaviness, that they might be called trees of righteousness, the planting of the Lord, that he might be glorified. So when we're suffering with that heaviness and that mourning, we become part of the Lord's vineyard, and he is glorified and we are glorified in him. And of course, Matthew chapter 5, verse 3 on the Beatitudes, blessed are the poor in spirit, for theirs is the kingdom of heaven. Keep in mind that the blessed, that word, is from the Greek translation of the word makarios, which means fortunate or congratulations. So I'm having a baby, makarios, congratulations, blessed are you. I won the lottery, blessed are you. I'm super depressed, and Jesus is saying, blessed are you. I'm like, why would he say that? Because when we are in that suffering and in that sorrow and in that anxiety where we just feel like we're going out of our mind and we can't feel the Holy Spirit, Jesus is there with us, and it draws us closer to him. So that is when we know Jesus is in the extremities of our pain and our suffering and our anxiety and our trials. And of course, in Hebrews chapter 4, verses, 15 and 16, for we have not an high priest which cannot be touched with the feeling of our infirmities. Jesus knows what we're doing, what we're feeling, what we're suffering with, because he felt it too. Verse 16, let us therefore come boldly unto the throne of grace, that we may obtain mercy and find grace to help in time of need. His grace is there for you. Even when you feel abandoned, he's there. So that is what I want to talk to you about. Sometimes all of this is just not enough, and you still feel isolated, and people start contemplating suicide, and this is something very important I want to talk to you about. If you are thinking about ending your life, then please tell someone. Call the suicide hotline. That number is 1-800-273-8255. I promise, no matter what you're going through, please get help, because if you leave, it's so permanent, and the people left behind are devastated. So please, please, please get help. And if all this happens and you, again, how do you explain this to your friends and family? Just tell them, this is my trial, this is my health condition, please bear with me and give me grace. Last, I wanted to tell you, if you need more information, I actually wrote a little book. It's on Amazon for $8. It's tiny, it's a quick read. It's called Happy Naturally, a quick guide to supplement, I had to look at my own title, a quick guide to supplement and self-help tools for depression and anxiety. It's $2.99 as a Kindle version, and it's $8.99 or $7.99 as a book. So if you want to read more about what we're talking about and hear more about my story as a patient who was depressed and anxious, then you're welcome to get this. Last thing, again, talk to your family physician. If you really don't have someone that can care for you, I do telemedicine. Have a full practice, but if you say that you saw me on the seminar and you really need primary care, I do telemedicine wherever you are in the United States, and we can get you going on the right path. So thanks for watching. Good luck with everything, and have a great day.